All right, welcome, Dr. Beadle. Thank you for coming on here for our Spotlight series for the Best of Utah Pelvic Health. I'm excited to
Thank-
dive in. I'm just going to read a little short bio about you so our audience knows who you are, and then we'll jump into all the fun questions.
Sounds good.
Great. So, Dr. Beadle understands exactly what you're going through. He used to be in your shoes. Growing up with low back pain, he thought it was normal. He'd occasionally visit a chiropractor and get some relief, but the pain would always come back. After a while, he started to feel like he could see 5 chiropractors in one day, and then they just keep finding more things to adjust. What he really wanted was for someone to say, "You're good, no adjustments needed today." It wasn't until he went to chiropractic school at Life West that he learned the truth. Having low back pain wasn't normal. He truly didn't know that. When he finally committed to regular chiropractic care rather than just 1 or 2 visits a year, his back started to feel great. And it stayed that way. Now, when he feels pain, he doesn't even hesitate to see Dr. Miranda because he knows that his life will be pain free and he wants to keep it that way. Around the same time that he started chiropractic school, his wife and him had his first child. Their daughter was in a posterior position, which caused his wife tremendous pain during delivery. While she managed to get through it, he hated seeing her suffer. As he progressed in school, he realized how much chiropractic care could have helped her. That's why he became a Webster certified chiropractor and completed over 300 hours of pediatric and perinatal training. Thankfully, when they had their second and third children, everything went a lot more smoothly. If you want to experience long-lasting pain relief, move more freely, reclaim your health, and restore hope, book a free consultation with him today. So that's your bio, and I'm so excited to have you on here. I know we've been friends for a while. And we're just going to jump right into the first question right off the bat of
Okay.
what made you decide to be a chiropractor. And a little bit of that came out in your bio, but let's dive just a little bit deeper into that.
Well, do you want the funny story or the spiritual story? Like,
Ooh, maybe a
so
little bit of both. A
I
little bit.
really, everything's a spiritual journey, right? Like it just is.
Yeah.
But I like the funny one first. So the funny one is, I'm the youngest of 9 children, right? And so I wanted to always emulate my brothers and sisters, and I still do. Like it's still a thing. And one of my brothers, he's 10 years older than me, and he's like, "Hey, we should become chiropractors." I'm like, "Oh, that sounds awesome." He's like, we could call our practice Two Fat Guys." I'm like, "Let's do it. That'd be awesome. Let's do this thing, right?" And so like from then on, I'm like, I'm gonna be a chiropractor. And he ended up being a teacher. He actually teaches at Westlake. But I kept pushing forward, and I kept telling people, like, yeah, I'm gonna be a chiropractor, I'm gonna be a chiropractor. But I really didn't know, right? And went on my mission, came back from the mission, and I'm still telling people, yeah, I'm gonna be this chiropractor. But like this whole time, I'm praying my guts out, being uh, like, what do you want me to be, right? And long story short, someone asked me a question like, "Hey, how do you know when the Spirit's talking to you?" I'm like, "Oh, I'm a returned missionary. I can tell you, I can do this, right?" And so I start talking about that, and all of a sudden it dawned on me, I'm like, "Holy cow, he's been telling me this whole time that I need to be a chiropractor." And so I went back, I prayed, I'm like, "I'm sorry, I wasn't listening." And he's just like, it's okay, like most of the kids don't listen anyways, but whatever, that's cool. And it was, for me, it was really impactful to actually see how he's like, look, you need to learn how to heal people and how to help people without drugs, really. That's where it comes down to, right? Without having to rely on other external sources to be able to get your help. It's like, no, like, just with your hands, with your knowledge, to be able to help out people. And it was like, okay, got it. Like, not putting down the other professions. It's just, for me, that's what I needed to have. And so it was pretty cool. I was very excited for that. So yeah, that's why I'm a chiropractor.
I love that. Love that. Okay. What makes you different?
I'm weird, I okay, so this is actually kind of fun. Yes, I'm different by how I do things, by how I treat people. I had another practice that I was in Florida, and they're very much like, you are Dr. Beadle. You need to use doctor language. And I would talk to people and be like, "Oh, hey, it's awesome that," or "It's really cool how," and they're like, "No, no, no, don't, you can't talk like that." And it killed me. It just killed me inside. When I got back here to Utah, I was like, I'm going to practice my authentic self, right? If I think something is ridiculous, I'm going to call it out. If my term that I've been using for the past like 4 months for some weird reason is poopy caca. If it's poopy caca, it's poopy caca, and let's just honor that and be like, all right, that's just what it is. And the thing is, people get that,
Yeah.
right? I don't have to be like, oh, you have a bursitis in your shoulder, or you have, it's just, hey, let's just say this is horrible and let's just fix it, right? Let's go for it, right?
Yeah.
Um, so that aside, my personality of craziness aside, I am, if we were kind of talking about this before we even started talking, I'm hyper analytical, right? The techniques that I've been driven to like practice in our clinic here, it's very analytically satisfying to just look at it and understand and know the problem and know how to fix the problem and know when I actually need to step back and say, hey, you know what, this isn't my problem anymore, we need to refer you somewhere else.
Mhm.
And I like in that bio, it kind of talks a little bit about that, where it's like I wanted a chiropractor to say, hey, you're good, right? I felt like I could go to someone and then go right around the corner to another person, get another snap, crackle, pop, go now around the other corner again and see 5 different chiropractors, and they could just keep adjusting me. And I'm like, at what point am I good? Like, I've got to be good at some point, right? If I go to a dentist and say, hey, and do I have a cavity? Like, yeah, you got a cavity. And I go around to another dentist and they say, hey, you have another cavity. And it's like, what, why? The other one should have fixed it by now, right? Like that shouldn't be happening,
Right.
right?
Yeah.
So that's what drove me to do these upper cervical adjustments, and also with activator. It's just so much more fun to actually say, here's the problem, we're going to fix the problem, and we're okay. We can now move on. So I
Yeah.
love it.
Hard for the patient too. Okay. Who is an ideal fit for you?
So we help kids and adults all the way up into the hundreds and such, which is kind of fun to do. My ideal though, I love pregnant moms. Like it is just my happy fun spot. The embarrassing story. If you, do you like embarrassing stories? Is that
Yeah,
okay?
it's on the internet for you, not me.
So my daughter, this is my oldest daughter. She's in first grade, and she raised her hand, and to her credit, she just wanted to share the awesomeness of life, and she's like, my dad likes pregnant women. I was like, okay, this is like in her first grade class. It was just like, oh my gosh, like okay, well,
Need some
yes,
context. Yeah.
let's get some context, please. Like that'd be great. So, yes, I absolutely love helping moms, mainly because of the experience that we had with our first kid. Right when I saw how much of a struggle it was for her to go through that, I was like, I don't want anyone else to go through that, and it hurts me. Like I love it and I hate it at the same time when moms come in and they're like, yeah, I just have the normal pain of being pregnant. Right? I'm sure you deal with this all the time, and you're like, oh dear, like
Like,
this is not normal. This is
okay.
not, it's common, right? But it's not normal. Like, let's like take that away from your language and let's like reframe that a little bit, because this is not normal.
Mhm.
And I love seeing their reaction afterwards, where I just do a couple of adjustments and they stand up and they're like, oh, it's gone. I thought that like this was just how it was. And it hurts me because there's so many people who just don't know. And
Correct.
that is what's sad, right? And I love it because it's so quick to fix. And it's just awesome for that one. So
In the
yeah.
toolbox to fix it. Yeah.
Yep.
Okay. What's the process look like to work with you?
So first off, they can call up, come in, or they can just schedule online. We have a conversation, see are we even a good fit from just the conversation. There's an exam process, right? And the exam says, hey, what's the biggest, craziest thing going on in your body that we need to tackle, right? And I like to kind of do like a 2 week snippet, right? Like we're just going to focus with you for 2 weeks, and then we're going to do a reevaluation and see, are we actually making clinically significant changes, or are we just like, hey, you're a cool guy, you're a cool girl, but we're not actually like doing anything significant, right? If that's the case, then I like you, you're awesome, you're a daughter of God, and I'm a son of God, and happy day, but you don't have to keep working with me, right? So that exam is kind of everything. It really lets us know where to go. So it's a full neurological, muscular exam. We're looking at cranial nerves. We're looking at myotomes. We're looking at alignments. We're looking at can you even just smell properly, right? I mean, just like basic things
Mm-hmm.
that unfortunately is not done very much in healthcare. We're also looking at inflammation levels, and we're looking at the lymphatics. We're looking to see, are the lymphatics actually free and clear, or are they gummed up? So it would, top to bottom, we're just looking at all the major systems of the body. And if your atlas is out, which is that top vertebra right up there, there's some easy findings that we can see in the exam to see if it's in or out. And if it is out, then we actually do take x-rays of the upper neck. And those x-rays let us know how to fix the problem, right? We don't x-ray everyone. Not everyone needs that. But if you do have an atlas issue, then absolutely, like that's where the brainstem sits. You don't want to mess around with the brainstem without knowing what's going on. So that's, yeah, we definitely take x-rays on that one. But everyone else, yeah, pretty good. So that's kind of the process, if you will.
Awesome, great. And then in the grand scheme of things, from like especially pregnancy shifting into postpartum, what does recovery mean to you, or what does that look like in your practice and clinical ethos?
I'm glad you bring that up because I ask doulas this all the time. I'm like, okay, like what does it look like after baby comes? Because there's all this buildup and all of a sudden just like no support afterwards. We love having moms and babies and dads. Right? We have a little party afterwards. The party is like everyone comes together and we adjust to everyone, and it's just this fun little cool thing. Want to make sure that moms are okay, right? Got to make sure the sacrum's okay, the pelvis is okay, your tailbone's okay. L5 4 3 2 1, all your stuff to like all of that needs to be good. And everything transitions from the pelvis to now, okay, we're carrying baby and we're carrying car seat, so now the upper back is just kind of being a mess. So we check out everything.
Mhm.
And usually for moms, that's 4 5 6 visits afterwards. You're pretty much good. You don't really need too much more after that postpartum. But most people like to do like a monthly maintenance because they're like, I like feeling good. It just feels good to feel good, right?
I'm like, I
Um,
like it, so I'm gonna do what I need to do to feel good.
exactly. Baby wise, it's such a crucial visit because usually there's like latch issues or they're colicky or their digestion's weird. And chiropractic just does a fantastic job helping out all those issues. And so a lot of moms were like, wait, when do we need to come back postpartum? I'm like, ideally like day 3, right? Because day 1, everyone's exhausted. No one wants to do anything, right? Day 2, it's like, okay, I'm starting to like feel kind of maybe normal. I might take a shower, I might not, right? Dad's included in this. Like everyone's just exhausted. Day 3, you start to see trends, right? Where it's like, hey, baby's not latching really well, or they're not pooping really well, or they're not peeing. Like something's off, right? So I like that day 3 as that first follow up, and I throw dads in there because man, I'm a dad, right? Like I was exhausted. Like I know we don't talk a whole lot about that process for dads, but like I'm pushing on her hips, I'm sweating, I'm just trying to open up her pelvis as much as I can. I'm exhausted, right? I have no there's no comparison, right? Like she's obviously doing way more than me, but I throw dads in there for that free adjustment because it's like, hey, they're more so worried about the money.
Yeah.
I just want their health to be great. So if everyone's well adjusted, it's going to be a way better experience for everyone, and it's a lot of fun. It's a lot of fun to do those.
Amazing. Amazing. Okay. All right. What is something that most people don't know that you think that they should know about, whether that's chiropractic, pregnancy, birth, health and wellness? Like, what's your one nugget that you want to give us?
Okay, I think going back to that story where pain is not normal,
Mm-hmm.
right? And to never be satisfied if you have pain, right? Like find something. There's got to be something out there. It may not be chiropractic. It may be acupuncture. It may be you need to stop eating cashews. I mean, it could be so many different odd things, but like that's your drive to figure out your health, right? Um, so just don't be satisfied with I'll just gotta live with the pain. It just makes me cringe on that one. And I'm more than okay to say it's not a chiropractic issue, right? It's just it could be anything. It
Yeah.
could be a mental mindset, right? But never just accept pain as a normal part of life. Okay, I got a story time, right? I got too many stories. I'm sorry. You're like, this is supposed to be like a 5 minute, session.
You're totally fine.
So this is actually when I was in student clinic, right? I'm a little newbie. I just barely understand like there's a thing called a vertebra in your spine, right? Like I'm very, very beginner on this one. And I'm in the clinic there at the school, and someone in the ward, they had a kid who was 4 years old, had a bunch of MRIs, and she has this, just migraines that are just would not go away. And the doctors just said, well, some kids just get headaches. I was like, are you freaking kidding me? Are you kidding me? Like, this is no, this is unacceptable. So reached out to them, like, please come on in. We took x-rays, we adjusted the atlas, headaches went away, right? And I was just like, just don't be satisfied with that answer of like, well, sometimes it just happens to people. And I was like, oh,
Yeah.
no, just be driven and find something else. It's
5,000 soapboxes is that, right? Awesome. Okay. Well, thank you for sharing that. Do you have anything special that you want to promote to the audience watching here?
Oh man, you know what? I'll give a high five to anyone, but hey, promo to anyone. Let's see. What can we do for you? Well, one, if you know Betty, like there's just perks to it. So come on in and let's do this one. So we can't like give too many financial incentives, all the rules and regulations. But hey, mention this. We'll just throw, $10 off, right? Right. Just like we'll do the $10 off and have a happy day. But come on in and we'll chat it up and we'll make it work.
Awesome. Well, thanks, Dr. Beadle. Okay. Last final question here. And
Okay.
my favorite question to ask is, what is the main thing that you want to be known for?
Oh, that I am. That's a good question. Yeah, what are we known for? Going back to the spiritual thing, right? Because it's just like, what really do I want to know? That I love my wife, I love my kids, and that I have integrity when it comes to letting people know what's going on with them, right? That one, I am truly authentic with being that genuine self, saying that if I'm saying you need something, I'm being genuine that that's what you need. It's not a financial incentive. It's not a, oh, great, I get to go on vacation more often. It's like, no, I genuinely care about you as a person, as an individual, right? You're not just a number. I'm not a high volume practice for a reason, right? I don't want to see the masses. I don't want to see millions of people. I want to see the select few who are like, hey, I need a conversation with a doctor, right? I want to spend some time with someone to just talk it out and figure out what's going on. That's what I like. I like being that person, right? And that's okay. Like I love that there's places like the Joint where they can see the masses. That's fantastic. Like I love that there's chiropractors who do see 1,000 patients a week. Fantastic. You go for that. That's not me, right? I like to slow it down. I like to ask the questions and I like to know who you are personally, right? It's a relationship that I like to build with people.
Love that. Love that. Okay. Where can we find you? Website, social media, all the things.
So soundcorrections.com. We're in Orem, Utah, right next to the mall. And it's a great clinic, right? We've got multiple people here, multiple different businesses, and you can't miss it. It's right on the corner. But yeah, I mean, you can just give us a call, 801-900-3223. You can email me, Dr. Beadle at soundcorrections.com. We're on social media. We're wherever we need to be. But easiest way, give us a call or find us on the website. That's great. Yeah.
Okay. Well, thank you so much, Dr. Beadle, for coming on and having a good time with me today. I look forward to seeing you next time.
Okay. Thanks, Betty. Appreciate it. We'll see you.